Hello everyone, welcome to the OSCE class. My name is Soraya, and I am an OSCE facilitator. Today you are going to learn NMC Skill Station of Nutritional Assessment with me. You will see step-by-step guidance, including verbalization, calculating the must score and completing the nutritional assessment chart according to the NMC marking criteria. Nutritional assessment is an 8-minute skill station in OSCE exam, in which you are required to calculate the must score and verbalize the intervention. Remember, this is half written and half verbalization station. Now read the scenario carefully. Please see the scenario on the screen, which states: you are a mental health nurse in the community. A patient named Marie John lives at 22 Broadway, West York. Her date of birth is the 2nd of June 1985. And she has been referred to you for her symptoms of reduced appetite due to anxiety and depression. She lost about 3.4 kilograms of weight last month and eats very little of all her meals. She is at risk of malnutrition. Her current weight is 56 kilograms, and her height is 1.62 meter. Please complete a must assessment and discuss findings with your assessor. All the equipment you need is provided. You are required to document and verbalize the findings during this station. You have 8 minutes to complete this station. Assume it is today and it is 11 o'clock. You should be provided nutritional screening tools to calculate the BMI score and weight loss score. You can see the 5-step guidelines on the screen. First step is to calculate the BMI score. Then second step is to calculate the weight loss score, and third step is to calculate acute disease effect score. In step 4, you will add all the scores together and calculate the total must score. In step 5, you will identify the risk category. You need to verbalize the total score and the risk category, low, medium, high, in step 5 and verbalize the care plan to prevent malnutrition. First, we will see how to calculate the must score through step-by-step guidance. First, calculate the BMI score and then weight loss score. Please see the screening tool chart on the screen. According to the scenario, patient height is 1.62 meter and current weight is 56 kilograms, and patient has lost 3.4 kilograms weight in the last month. Remember, if you are given height in meter, then you need to look at the bottom of the chart, and if it's in feet and inches, then you should look at the top row. And same if weight is given in stones and pounds, then you should look at right side of the chart in here, and if weight is in kilogram, then you should look at the left hand side here. In this scenario, you are given height in meters, so look at the bottom line 1.62 meter, which I marked here. Then check current weight of 56 kilograms on the left side of the chart and look for BMI. Now, draw a line and see the meeting point for both lines of height and weight. You can see here BMI is 21 and BMI score is 0, which I have marked already. Remember, you need to write BMI score, which is 0, not BMI, which is 21. Now we will look for weight loss score. You can see the screening tool on the screen. At the top is a score category. If weight loss score is less than 5% or less than weight in kilogram, then score will be 0, that you can see in first column. If weight loss is 5 to 10% or between weight in kilogram, you can see limits in middle column, then score will be 1. If weight loss score is greater than 10% or more than weight in kilogram, see the limits in third column. Then score will be 2. Let's calculate weight loss score for the scenario. So patient weight is 56 kilograms, that you can see on left hand side of the column, and patient weight loss is about 3.4 kilograms. If you see first column, it shows weight loss less than 2.9 kilograms. That does not apply on our scenario. Let's see middle column, which shows weight loss between 2.9 to 6.2 kilograms. Our patient weight loss is 3.4 kilograms, so it falls in the middle column, which gives weight loss score of 1. Now, step 3 is acute disease effect score. It is not applicable to our scenario, as our patient's still eating little. Now you need to calculate the total must score and find out the risk category. We already find out the BMI score is 0 and weight loss score is 1. We did not add acute disease effect score of 2 as our patient reduced appetite but still eating little. We have identified that total must score is 1 and risk category is medium risk that you can see on the screen. Now, we will document on the nutritional chart. I have already pre-filled the chart. You can see on the screen. Remember to complete the chart correctly. You are required to write your name in front of candidate name, then write patient information in this column. I have pre-filled name, address and date of birth. In the first column you will enter the date, and in second column write time according to your scenario, then BMI score in step 1, then weight loss score in step 2, and step 3 column leave it blank or put it 0 as it is not applicable to our scenario. Then do not forget to enter overall risk of must score, that will be your total must score, which is 1 here. In the last column you should write your name and initial. You can see after calculation total must score is 1, that indicate that patient is at medium risk of malnutrition, which you can see on the screen. Now you can verbalize the risk category that total must score is 1 and patient is at medium risk of malnutrition. Also verbalize the intervention, for example, documenting dietary intake for 3 days, encouraging frequent meal, creating care plan to improve nutritional intake, referring to mental health team to treat underlying condition, recording need for special diet and follow local policy, monitoring and reviewing care plan monthly if patient is in the community. Let's see another scenario, which is in a hospital, and you need to complete a different chart. Please see the scenario on the screen, which state that Betty John's date of birth is the 15th of October 1982, and her hospital number is 456123. She has been admitted with anxiety and depression. The patient is having panic attacks and refusing to eat and is now feeling very ill as the patient didn't eat for the past 6 days. Her weight loss is 2.9 kilograms in the past 3 months. Please perform a nutritional assessment and discuss the findings. Assumed date is today and time is 1400 hours. The nutritional must assessment provided with patient's height and weight on the assessment chart, which you can see on the screen. You need to complete this chart if your scenario is in a hospital setting. You can see it is different chart and patient information is already pre-filled. If it is not pre-filled, then you are required to complete all the information according to the scenario. Patient weight is 52 kilograms. Height is 1.60 meter. According to the scenario, patient weight loss is 2.9 kilograms. Let's calculate must score using must tools. We will locate first height, which is 1.60 meter at the bottom of the chart, and then locate weight left hand side, which is 52. I have already marked. You can see BMI is 20, that mean BMI score is 0. Remember, we need to write BMI score, not BMI. Now we will find out the weight loss score. Please see must tool chart on the screen. First, we will locate the patient weight on the left side, which is 52. I have marked already. Now we will find out in which column weight loss score falls. So patient weight loss is 2.9 kilograms. If you see in the middle column, it shows weight loss between range in kilogram. Look in the column next to weight of 52 and you can see that weight loss of 2.9 falls in middle column, where range is weight loss between 2.7 to 5.8. Now look at the top middle column, which shows score of 1. It means weight loss score is 1. If you are given weight loss score in percentage, then you need to look at the top column and calculate the weight loss score. We have already completed the step 1 and step 2. Now see step 3. As our patient is not eating for the past 6 days, we will add score of 2 for acute disease effect. If we add score, it gives us total score of 3, that indicate that patient is at high risk of malnutrition. You can see on the screen. Now we will enter this information. Patient information is already pre-filled. Now circle BMI score of 0 in first column of step 1. Then in the column of step 2 circle 1. And for step 3 circle score of 2 for acute disease effect as patient is not eating for the past 6 days. Now enter total must score in the last column, which is 3, that indicate patient is at high risk of malnutrition. Do not forget to enter the total must score. After calculating total must score and identifying risk category, verbally propose plan to improve nutritional intake. Now you can verbalize that patient BMI score is 0 and weight loss score is 1, and score of 2 for acute disease effect is also added as patient is not eating anything for the past 6 days. Total must score of 3 indicate that patient is at high risk of malnutrition. Also verbalize the intervention, for example, referring to the dietitian, encouraging frequent meal, creating care plan to improve nutritional intake, referring to mental health team to treat underlying cause, providing assistance if required, recording need for special diet and follow local policy, monitoring and reviewing care plan weekly if patient is in hospital. Remember to complete the chart correctly and enter the date, time, and signature in the last column here. I hope you enjoy the video and learn how to correctly complete the nutritional assessment. Please remember these are not actual patients, it is only created for training purpose.